The Pure study is being done in 27 countries, 200,000 people. It's the only prospective study involving so many countries and following risk factors. What we have found is that in the richer countries, high-income countries and upper-middle-income countries, cardiovascular disease rates death rates have been overtaken by cancer death rates. And I think the main reason is we've made tremendous strides in reducing cardiovascular disease mortality, and largely due to better treatment and better risk factor control. And so obviously other causes of death are increasing. We also found that as before, high blood pressure, high cholesterol, and tobacco matter, but low education is a very important risk factor. Poor strength is a very important risk factor. Air pollution is increasingly being recognized as an important risk factor for both cardiovascular disease and mortality. And strength, this has been neglected. And grip strength, which is a crude marker of overall strength, seems to protect you. So if your grip strength, if you can squeeze 50% of your body weight, you're in good shape. If you can only squeeze less than a quarter of that, that's not very good. So some new risk factors have come out. The other thing is BMI is not a very good risk factor. There are others like waist to hip ratio, but even better, strength to weight ratio, because that's telling you how much of your weight is muscle and how much of your weight is fat and other things. And these are now increasingly being shown to be important. Yesterday, we presented data from the Pure study on different anthropometric features, and in fact, the lowest risk is in the BMI group between 25 and 30. It's not below 25. In fact, mortality goes up below 25. And a clear increase in mortality is only seen in BMI over 35, although there is an increase in cardiovascular disease rates with the BMI over 30. Now, risk factors do go up even at lower levels of BMI, but in the end, risk factors are numbers. What you really want is, will you live or die? Will you avoid a heart attack or not? So I think the obesity story needs to evolve and to be rethought, and we should supplement that with strength. I think there are a number of things that have to be intervened on at the systems level. In fact, everything needs to be thought of at the systems level. So even things like air pollution is a systems level. Access to healthcare is a system level. Affordability of key medications is a system level factor. But even individual, like diet, depends on affordability of healthy food. So that's a systems level thing. Tobacco, we think of it as an individual behavior, but that's also systems. It depends on the cost of tobacco, the education around tobacco. So we have underestimated the importance of systems and environment, because they do affect what you do individually. Now, there are individual things people can do. Make sure you check your blood pressure, and if it's elevated, make sure it's treated and controlled. If your lipids are elevated, make sure it's reduced. If you're a smoker, try to avoid smoking. If you're weak, try to improve your strength. So these are individual factors, but these individual factors are affected by systems factors.